Hi, a very good morning to everyone. Thank you for spending the morning with us to learn about how to manage obesity and diabetes for better heart health. I'm Dr. Ruan Xucong, Associate Consultant in the Department of Cardiology at the National Heart Centre, Singapore. And together with me, we have a panel of experienced content experts who will share with us on various aspects of the medical and surgical management of diabetes and obesity. I'll start first on a brief introduction of what is metabolic syndrome, after which our second speaker will be Dr. Tan Hong Chang, who is a senior consultant at the Department of Endocrinology, Singapore General Hospital. He treats patients who suffer from diabetes, obesity, and lipid disorders. In addition, Dr. Tan also conducts medical research in these areas. He will share with us on the medical management of obesity and diabetes. Our third speaker will be Dr. Lee Zhenjing, who is a consultant specializing in upper gastrointestinal and bariatric surgery at SGH. His clinical interest includes bariatric and metabolic surgery, so he will share with us more regarding the surgical management of obesity. Our fourth speaker will be Ms. Tan Aishan, who is our principal dietitian at SGH. Her work focuses on offering tailored dietary advice and assistance in individuals striving to attain sustainable weight loss goals for long-term better heart health. So without further ado, we will start on what metabolic syndrome actually is. Metabolic syndrome refers to a cluster of risk factors specific for cardiovascular disease, and it increases the risk of developing diabetes, heart disease, and stroke amongst the general population. This is a growing public health concern that affects millions of people worldwide, so therefore the importance of us talking about this during the public seminar. So the criteria for diagnosing someone to have metabolic syndrome is if he or she fulfills 3 out of the 5 criteria that I've listed here. And the criteria include that of abdominal obesity, high blood pressure, high triglycerides, low HDL cholesterol, as well as diabetes or elevated fasting glucose. So you may ask, what is HDL cholesterol? HDL cholesterol is actually the good cholesterol in the body, which protects against heart disease. And if the individual fulfills 3 out of the 5 risk factors that I've stated here, unfortunately, he or she will have met the definition of metabolic syndrome. So what causes and contributes to having metabolic syndrome? It is actually multifactorial and encompasses both genetics, lifestyle, as well as the age of the individual. So of course, if the individual has a sedentary lifestyle, takes unhealthy food, lacks physical activity, it will contribute to the risk of developing metabolic syndrome. And this risk will be increased as one progressively becomes older. So what can we do to prevent this from happening, and how do we treat it? So the treatment usually involves lifestyle changes. This means losing weight, working with a dietitian to change your diet, getting more exercises. Losing weight will help to increase the good cholesterol and lowers the bad cholesterol, as well as the triglyceride level in our body. Losing weight can also reduce our risk for having type 2 diabetes. Of course, there are also medications that can help, and that would include cholesterol-lowering medications, diabetes medications, blood pressure medications, as well as weight loss medications. So Dr. Tan will share with us a little bit more about the medications that can help patients lose weight, as well as have a lower likelihood to having poorly controlled diabetes. In summary, the management of metabolic syndrome will encompass first knowing that one has metabolic syndrome in the first place. And of course, after we have diagnosed one to have metabolic syndrome, it requires a comprehensive approach of lifestyle change, medications, and regular monitoring to ensure that the individual is kept in good health. Of course, as healthcare professionals, we'll work with you during this journey.